having me. I didn't realize that there were so many people on this chat. And like I said, it's a little intimidating. But I love doing these virtual shadow sessions and just talking about, how cool it is to be a cardiologist, how cool it is. Yeah, Zot. How did you know that I was from UCI? That's awesome. How cool it is to be a cardiologist and how cool it is to be able to be a female in cardiology. And so awesome. There's a lot of second timers here. This is very exciting. So, it's always great to be able to share, my career and the aspects of my career with everybody and really just, talk about how awesome it is and my journey in getting here, because it is a very cumbersome journey that I have gone through. And so, rather than go through like a case of what do you do with chest pain? I mean, I think the more interesting thing is, well, how did you get to where you got to, right? And that's also one of the reasons why I joined the public aspect of social media as a medical professional, because I really felt like it was important to share my journey. I think a lot of people, assume that doctors just have this like one straight path as to how they got to where they got to, where it is definitely not the case, and especially not with me. So, if I can inspire future generations, then, I'd love to do that. So, to get started, I am a board certified cardiologist. I'm a non-invasive cardiologist, so I actually don't do procedures. Cardiology is a great multifaceted field. There are many different subspecialties within the field. There's interventional cardiology, where you can specialize in putting in stents and putting in valves and things like that. So it's very procedure heavy. There's electrophysiology, which deals with the electrical system of the heart. There's heart failure, which is advanced, heart failure and transplant, where you can put in mechanical assist devices and transplant hearts and deal with those very sick heart failure patients. There's cardio-oncology, which is a newer field where you deal with the kind of toxic side effects of oncological drugs that can happen in the heart. There's, women's heart disease, which is becoming a very hot topic. There's preventative cardiology, sports cardiology, advanced imaging like I do. You name it, there's pretty much every subspecialty within cardiology. So it's very multifaceted. That's one of the reasons why I went into the field, because I felt like I was never going to get bored. But the way that I got started, I actually didn't want to do cardiology to begin with. I was born and raised in Southern California. Go Lakers. And I went to undergrad at UC Irvine in Orange County, California, in Irvine, California. I did and majored in biological sciences, which, to be honest with you, I thought was a little bit of a mistake, because I thought that every person that went into medicine had to major in biosci. So my number one pearl to tell you from college is you do not have to major in biological sciences or in the sciences in order to go to medical school. So you can major in whatever you want, whether it's the arts, whether it's anthropology, whether it's English, whatever you're interested in, you can major in it. And then all you do is just take pre-med requirements. And so I wasn't really aware of that when I started college. And so my GPA actually suffered a little bit. And also my social life was up and thriving during that time. So I didn't I didn't put in as much studying as I should have, because I assumed that getting into medical school was going to be an easier feat than it was. And unfortunately, it was not as easy. So my second pearl for college is to study your butt off, right? So even though you might be doing an easy major, you still have to take these pre-med courses, and your grades matter. These days, medical school admissions committees love to have well-rounded individuals that they accept. However, what's heavily weighted, it's going to be your scores and it's going to be your grades. So make sure that irregardless of whatever you do really well in your classes, especially your pre-med courses. And, again, I get asked a lot, what are pre-med courses? So that's going to be things like physics, organic chemistry, general chemistry, biology, what else is there, guys? Biology, biochemistry, I think. Yep. Biochemistry, physics, English. I don't know about sociology. Anyways, yeah, all of those. And usually they're pretty standard across the board for MD and DO schools, and also Caribbean schools as well. It's pretty standard, the pre-med courses that you have to take, but it's actually a smaller number of courses versus, you know, what your actual 4-year major is going to consist of. So I definitely, like I said, recommend majoring in whatever you want to major in, and then just take your pre-med courses. It'll probably be an easier feat and you'll probably get a better GPA. Anyway, so I majored in biological sciences. My GPA was okay. It wasn't stellar. Like I said, I took the MCAT. I did, again, okay. And then I think I realized during that time, that I was going to have a difficult time getting into a US med school. So I actually decided pretty early on after I took the MCAT that I was going to end up going to a Caribbean school. I only knew a couple of people that went to Caribbean schools, so it wasn't a big it wasn't like a big thing back when I was in college, and I graduated college back in 2006. So imagine it's been a long time. And so I had to do a lot of research. I found that there were 2 top medical schools in the Caribbean. One was Ross University, the other was St. George. Those were the 2 top schools, and they both required MCATs, and they were both great schools in order for people to match. In order for people to have a good match in terms of getting matches into residency spots in the US. So I ended up going to Ross, and I graduated college in 2006. And then I started medical school in 2007. I went to Ross in the Caribbean. Another misconception of Caribbean medical schools is that, you know, it's a cakewalk, and, you know, we're sipping pina coladas all day on the beach, and it's beautiful. And that was completely the opposite of what my experience was. It was a very difficult experience. Medical school in and of itself is a very, very, very arduous task. And then having to then go to a Caribbean medical school is even harder, because you're, you know, thousands of miles away from your family and your friends and anything that you're familiar with. And the island that I was on was very underdeveloped. You know, it was considered the nature island of the Caribbean. And so I was not, I'm just going to say something. If you guys can kind of, because
I think you're muted.
If you guys can just save the questions till the end, because I'm getting a little distracted seeing all these questions. Sorry. So anyway. Geez, I'm on my phone and I'm having computer problems, and it's been a day. Anyway, so the Caribbean medical school route was definitely difficult. And, you know, it wasn't a dream like, you know, people had the misconception of it being. I started off with a class of a little bit over 400 students, and the attrition rate was extremely high, meaning the amount of people that dropped out from my first year class was extremely high. And I graduated with a class of a little less than 100 students when I graduated 4 years later. So the attrition rate was really high. Our first 2 years of medical school were condensed into 16 months. So it was basically a year and a half of 2 years of medical school material. So that's all your basic sciences, your anatomy, you know, physiology, everything that, you know, you learn in your first 2 years was condensed into 16 months. So we barely had any vacation. I barely went home. All we were doing was studying all the time. So it was definitely a very, very, very difficult task. And I knew that if I didn't do well at that point, then I was, you know, I didn't really have much else to fall back on. And I didn't know at that time whether I wanted to, like, what I really wanted to do. You know, I worked at a dermatology clinic prior to getting into medical school. I did like some secretarial work at like a dermatology clinic in Orange County. I really thought I wanted to be a dermatologist. Nothing wrong with dermatologists. They have a great lifestyle. They make great money. It's also a multifaceted field. But I think when I started medical school and I started to learn about the anatomy and the physiology of the heart, something kind of just clicked in me. And I was like, wow, this is actually really interesting. And so after I got off the island, I went to Miami and did a preclinical semester, which was like our fifth semester, which was a preclinical semester. I studied for my USMLE Step 1. Yeah, Miami. I studied for my USMLE Step 1 exam. I took my Step 1 board exam in Miami. I did pretty well on my exam, and then you start rotation. So your last 2 years of medical school consist of rotation. So your third year of medical school is core rotation. So that's like internal medicine, surgery, psychiatry, pediatrics, and OB-GYN. And so those are your main cores. And then you can take a couple electives. So actually one of the electives that I took was cardiology. And so I started off in Miami. I did the rest of the majority of my rotations and finished off medical school in New York. So I moved to New York for about like a year and a half before I graduated medical school. And I did this cardiology rotation, I remember, and basically they had me shadow this cardiologist for a whole month for 30 days. And I would shadow everything that he did. And so, one of his big tasks was to read EKGs every day. And so he would sit with me at the end of the day and read all of the EKGs that he had for the day with me. And, I didn't really understand EKGs at that point. I don't really know who does in medical school, but as he was going through these things with me, and he just kept on doing it every day, and he really took the time for me to learn and understand, I was like, wow, this is actually really interesting. And I started to, little things started to click, and I was like, I could really, I think this is like interesting enough to like make a career out of. And then I did an internal medicine rotation in Manhattan in the city, and I remember for some reason we were rotating with an interventional cardiologist, which is very atypical to do in an internal medicine core. But we actually went to a catheterization lab where they do procedures. And I just remember being incredibly fascinated. I saw the anatomy of the heart. I saw the coronaries that supply the muscle of the heart. I saw, how the procedures were done, just being in the lab, the excitement, even though it was a long procedure. And I remember most of my colleagues were not really happy about being there for a long time and having to wear lead and all these kinds of things. I just remember being extremely excited. And I was like, wow, this is really cool. And so I think all of those experiences encompassed really just kind of lit this fire inside of me that I was like, I really can make a career out of this. Furthermore, my father has had cardiac issues ever since I can remember. He had really poorly controlled blood pressure. He had to get a pacemaker. He had AFib, and then had a complication when he was getting a cardioversion procedures. Cardioversion is when you shock someone to a normal rhythm. So he had to ultimately get a pacemaker. He had to have stents placed. So, and at that time, I didn't really understand really what was going on with him. So I think it was always this like dream of mine to be able to, help him as much as I could, with me being in this field. So like I said, all of my experiences encompassed led me to want to do cardiology. I graduated medical school in 2011. And I didn't match into the program of my choice. So when you do a specialty like cardiology, you have to do an internal medicine residency. And so internal medicine residency is adult medicine. So, there's pediatrics, which is medicine that deals with children. And then there's adult medicine, which is internal medicine residency. So if you want to do cardiology, you can either do pediatric cardiology or adult cardiology. So obviously I went into internal medicine to do adult cardiology. And so, like I said, I had a lot of interviews during medical school when I was applying for residency. And I really thought that I would match at my top 3 spots. And I did. And I matched somewhere in the middle in a program in Brooklyn, New York. It was an okay program, but it was a community program. And I wasn't, happy there. And I remember matching there. I was devastated. I was like, my life is over, that whole deal. And then, when I started, I was like, I'm just going to give this a shot. Cardiology is one of the most competitive specialties to match into. It's very research heavy. They are very selective when, they're taking in, fellows into their programs. Spots are very limited. And so, it's a difficult specialty to get into. And so, you want to be in like a university program, a place where you can get involved in research projects and be around, bigger, academic setting, basically. And so I knew the setting that I was in, it was going to be extremely difficult for me to match into a good program. I made the difficult decision to go off the beaten path, and I transferred residency programs. So I gave my internal medicine residency my first year a try for a couple of months. I gave it the good old college try, and I was like, I just don't think that it's going to happen for me here. I was getting, scut work left and right. I wasn't learning everything that I needed to learn. I wasn't getting opportunities to do research. And so, transferring residency programs is not something that a majority do because you're binded in contract, but your contract is over after a year. And if you decide to transfer, then it is possible, but, the spots are few and far between a transfer to a second year spot. And so I had to take on the task of trying to find a second year spot. I literally called probably every single hospital within the United States, at least every major hospital, to see if they had open spots available. And then luckily I was able to transfer into a spot at University of Connecticut in Farmington, Connecticut, which is a great program. And especially for cardiology, it's an amazing program. So they have 2 cardiology fellowship programs there. So I was so incredibly fortunate to transfer there for my second year. And I finished off my residency for second and third year and graduated in 2014 from there. And so normally when you apply for fellowship, you apply in your third year of residency. So I actually ended up deciding that I was going to take a little bit of time off after residency, do a year in cardiac MRI and research, which was basically an advanced imaging year. So I went back to New York. I moved back to New York City, and I did this cardiac MRI, which is an advanced cardiac imaging fellowship. And it also had a lot of research that was involved. So I did that so I can be able to get published and have a really great CV prior to applying for fellowship. Then I applied for fellowship and I didn't match the first time. So now you see kind of my path, going to a Caribbean medical school, not matching into my top choice, still making the decision to transfer to get into an even better program. Then, I take off a year to do research and imaging. I don't match into fellowship the first time. So I'm kind of just hitting every bump in the road. And I wanted this so badly that I was like, I remember I had a conversation with a friend. I still remember to this day so distinctly. I had a conversation with my friend and she's like, Ambreen, you didn't match. What's your plan B? Like, are you just going to do hospitalist, which is basically an internal medicine doctor in the hospital? Or, are you going to join a practice? Like, what are you going to do? Because you can't just put all your eggs in one basket and think that you're going to match again. And I was like, there's no plan B. There's just plan A. It's going to happen. I'm going to match. And so basically, I worked my butt off. I published extensively. I took another year to do a year of hospitalist medicine at Montefiore in the Bronx. And then I applied for fellowship again, and I matched into my top fellowship choice in Philadelphia. And so I moved out to Philadelphia in 2016. I went to Drexel, and then I completed my cardiology fellowship last year, and I graduated last year. I was chief fellow of my program. I got extensive training in imaging, which just further solidified my interest in advanced imaging. And yeah, I, like I said, graduated last year, again, took off the beaten path and decided to do something called locums. And so basically I am a non-invasive cardiologist that works in a locum setting. So I signed with a company that basically outsources me to different hospitals that need to need temporary positions filled. And the reason why I wanted to do that was because I wanted to get my feet wet, wanted to be able to, kind of get a feel as to what I like. Do I like inpatient? Do I like outpatient? Do I want to do more imaging? Do I want more acute care? Whatever the case might be. And then the great thing is that you have a lot of flexibility in your schedule. So I basically make a full-time salary, only working 2 or 3 weeks a month. And so I've basically been doing that since August of last year. I'm board certified in echocardiography, which is ultrasound of the heart. I'm board certified in nuclear cardiology. I'm board certified in cardiology, and then I'm board certified in internal medicine. So it's pretty awesome that I've been able to do and accomplish so much. But as you know, so far, if you know anything about me, I'm still continuing this crazy path. So I'm doing locums right now, and I like it because of the schedule, but then the pandemic hit. And so I wanted to travel. I wanted to see my family. I want to do all that stuff on my off time, and I haven't really been able to do anything. And so it's actually one of the reasons why I created a social media page, because I was like, hey, what else am I going to do? And so luckily, I did pretty well with that. But I really realized that I miss academic medicine. And I really miss imaging. I haven't been doing that much imaging, especially advanced imaging. And, with cardiology becoming so incredibly subspecialized, even within imaging, I was like, if I want to move back to California, which I do, be able to get a job there and be able to get a really great, job in a great hospital, I think it might be a good idea for me to go back for more training. So guess what I did, guys? I decided to apply for another advanced imaging fellowship at a major university. And so I am going back and doing structural echocardiography and cardiac CT at Scripps in San Diego starting next July for a year. So I'm moving to San Diego in July, and yeah, so hopefully after that, some doors will open for me and I'll be able to, kind of get the job of my dreams that I've been looking for. So, as you can see, 4 years of college, 4 years of medical school, 3 years of internal medicine residency, 1 year of imaging and research, 1 year of hospitalist medicine, and 3 years of cardiology fellowship. So that's 8 plus 3, which is 11, plus 2, which is 13, plus 3, which is 15. And then that is now 15 years in order for me to become a cardiologist. And then 2 years of doing this locums business, and then doing another year of advanced imaging. And hopefully after that, I am not doing any more training because I got loans to pay. So yeah, I mean, I think my whole reason as to why, like I said in the beginning, why I love doing sessions like this is really to show you that nobody's path is straightforward. People look at me now and they think, oh, she has it all. She's a cardiologist. It must have been so easy to get to that spot. Or, she doesn't know what it's like to have issues. And trust me, there have been times where, I didn't know if I was going to be able to get to the next spot. There were times where I didn't know if I was going to be able to match. I didn't know if I was going to be able to become a cardiologist, let alone a doctor. There were times where I wanted to give up. There were times that, I had no idea what my next step was going to be. I made a tremendous amount of sacrifices. I've missed a lot of events. I, haven't seen my family for, months and months and months at a time. I, have made a lot of personal sacrifices in order to make my dream come true. But, that's the thing. If you want to be able to, achieve your dream, anything is possible, but you're going to have to make the sacrifices and put in the work, and eventually if you keep that, see that light at the end of the tunnel, it's going to happen. So that's kind of my path. Now, is that the typical path? No. I mean, most people go to 4 years of college, 4 years of med school, 3 years or 4 or 5 years of residency, whatever they do, and then, kind of go on from there. So my path isn't, necessarily typical, but at the end of the day, if you feel like you're struggling and you think, you don't know what's going to happen, or if you're ever, going to be able to achieve your dreams, don't ever think that, because anything is possible. You just got to fight for it and just keep thinking why you went into it to begin with. I kind of shared why I went into cardiology to begin with. I shared about, some of my experiences. I think a lot of people like to know what my day-to-day is. So locums is, interesting because I work in these different hospitals settings. And so I kind of do a mix of everything. And, being a non-invasive cardiologist is kind of cool because you do a mix of everything. So my day really varies a lot. And so, a typical day, if I'm doing outpatient clinic and doing rounds, I'll probably get to the hospital by like 7:30 or 8 every morning. I do something called pre-round. So I'll sit, in front of the computer, pull up the electronic chart, go through all the consults that I have to do, whether it's new consults or consults that I'm following up on, and, kind of review everything, review over labs, review over vitals, review over overnight events, notes from other specialists, notes from the primary teams as to what's going on with these patients, different consults that I can get. I deal with anything from somebody, wanting to have me evaluate their patient because they're having chest pain. And I have to kind of figure out, okay, why are they having chest pain? Arrhythmias, electrical system of the heart. They're having tachycardia. They're having bradycardia. Do they need a pacemaker? Do they need additional help if they're having like atrial fibrillation and they're not able to control their heart rate? Do they need to get, a cardioversion, which is a shock to the heart? Do they have endocarditis, which is an infection of the heart and the heart valve? Do I need to do a procedure called a TEE, which is putting an ultrasound probe into the esophagus, kind of like an endoscopy, and taking pictures and seeing what's going on there? Do they have a valve issue where, their valve is really leaky or really tight, where they're going to need to get valve surgery? Are they having a heart attack? Most of the consults that I get is, if somebody's having, it's something called a troponin. So it's basically a enzyme that gets elevated in the heart anytime that there's damage or strain to the heart. So that's not only because of a blocked heart vessel, which can cause a heart attack, obviously, but it can also happen for many other reasons. And so that's one of the main consults that I get, is people want to make sure that somebody's not having a heart attack from a blocked vessel, which would need a procedure. And so I get consults for heart failure, all of those things, preoperative clearance. And so I'll do my pre-rounds, and then I'll go and I'll see my patients. I'm very fortunate to have a physician assistant that works with me, and then a resident in another hospital that works with me. So one of the worst things about being a doctor is all this stupid paperwork that you have to do. So if I can cut down on some of my paperwork and be able to just, co-sign notes, that really makes my life a lot easier. And so, I'll go, I'll see maybe 10 patients at one hospital, 15 patients at another hospital. And then I have to go to clinic. So usually clinic is like 2 days a week. I'm seeing probably 5 to 10 patients in clinic. And, clinic patients, again, anything, any type of chronic condition, heart failure, heart attack, any arrhythmia type of problem, managing someone's blood pressure, cholesterol, et cetera, et cetera. And preoperative clearance, like I said. And so once I'm done with my consults, once I'm done with clinic, and then I go back, I finish up any paperwork I have in the hospital. I read stress tests. So that's nuclear, cardiology, doing like the treadmill stress tests, and, reading imaging stress tests. Then I do echocardiograms, which is ultrasound of the heart, and interpreting those images. And then electrocardiograms, EKGs, I have to read a few at the end of the day. And so it's a pretty busy day. I see patients on the floor. I see patients in the emergency room. I see telemetry patients. I see patients in the CCU. So, it's such a varied day, and you can see, very chronic patients. I can get like a cocaine chest pain, which is a very common thing that we see, especially in bigger cities. And, you don't take that as seriously as somebody who's having a massive heart attack, but I can see both of those patients in the same day. I can see somebody coming in with cardiac arrest, and the next day, see somebody that is coming in with severe endocarditis, and, they have to get a life-saving procedure. So it's awesome because your day varies so much, and you have an extreme impact on patients. I mean, think about it. I'm dealing with somebody's heart, right? It's one of the most critical organs in the body. And so how can you be bored? You can't. You're literally dealing with somebody's life in your hands all the time. So I think if you look at it that way, it's always interesting. It always keeps you engaged. And there's something for everybody, and it's a very collaborative specialty. I work with my proceduralists, which are my interventional colleagues, and electrophysiology colleagues. I work with my heart failure colleagues. I work with my imaging, colleagues. I work with my ED colleagues, and other specialists, and everybody kind of works together in order to help these patients. So, it's a really wonderful field. So I feel like I kind of rambled on a lot, and I wanted to maybe leave like the last like 15-ish minutes in order for us to go through some questions. So can we do that?
Yeah, of course. We'll totally do questions.
Should I go over anything else? Do you think I did okay?
No, I think that was thank you so much. That was a really inspirational talk. I think we all kind of saw that,
Cool.
you know, we can get through it. So I think one of the questions, and I see that we had it now and then, we usually get it, is what are your thoughts on like MD versus DO, and for you specifically, like in cardiology, do you have any DO colleagues in cardiology?
Oh yeah. So so there is not a difference in MD and DO when it comes to practicing medicine. So MDs and DOs are completely equivalent when it comes to practicing medicine. And so this is like the major advice that I'm going to give you. One of the regrets that I do have, even though I do not regret going to a Caribbean medical school in my personal path, if I give advice to future physicians like yourselves and you want to go into medicine or pursue that route, becoming a physician, I advise not to go to a Caribbean medical school. And this is why, because once you get into a US MD or DO program, literally your life is set. Okay. It's just, it is what it is. It is that way. Having had gone to a Caribbean medical school, my life was just that much harder because I had to work my butt off that much more in order for me to prove, you know, to others that I was as comparable to my US colleagues, even though we, you know, went to the same residencies, went to the same fellowship programs, you know, we work in the same hospitals together. There's no difference. You know, we have the same degrees. Unfortunately, at the end of the day, that Caribbean school is going to be on my resume forever. And, you know, like I said, I don't regret it, but if I give advice to others, it's always try to get into a US MD or DO school. Is it a little bit more difficult? Yes. Is it easier to get into a DO school than MD school? Maybe like, you know, a few years ago. I think now both are pretty competitive and pretty comparable. The difference is just in terms of your schooling. Actually, DOs have to do a little bit more training and like the osteopathic, like holistic side of medicine. So they take a couple extra classes during medical school. But in terms of, you know, being able to apply to the same residency and fellowship programs, there's absolutely no difference. So if you are able to apply to both MD and DO, I highly encourage that. The other thing that you can do is if you find that, you know, maybe your MCAT score, GPA score is just not that good, apply to an US MD DO school irregardless. And if you can't get in, or if you think that it's going to be too difficult to get in, you can take a year off. People do this all the time. You can take a year off after, you know, your college, you know, after receiving your college degree, and then do a master's program, do an MPH, do an MBA, do a master's in, you know, some kind of science, and, you know, be able to, you know, then get a little bit more experience under your belt. And then hopefully that will help you ultimately, what is going on with my hair? Hopefully that will ultimately help you get into medical school. You know, unfortunately, medical school is just a really competitive game, but you got to try to do everything that you can in order to get in. But my number one advice, even though, like I said, I went to Caribbean medical school, if you went to Caribbean medical school, you will be fine. You have to work your butt off, you will be fine. But my advice is to try to get into a US or a DO program. And, you know, like your original question, there is no difference in terms of practice, getting into training programs, or ultimately practicing for MD or DO programs.
Great. And I guess kind of going off of your Caribbean medical school experience, when you were applying to that, was there a different application process? Did you still have to take the MCAT? If you could kind of talk on like differences between applications.
Yeah, so I mean, I actually never applied to a US med school. I only applied to one, actually applied to 2 Caribbean schools, and I got into St. George and I got into Ross, and I just decided to go to Ross. So I think the application process is, I mean, to be honest with you, it's been a very long time. I went to medical school in 2007, so I can't really tell, I can't remember a lot in terms of application, but I can tell you that the requirements in terms of pre-med requirements, MCAT requirements, being able to having to go to a college and get a college degree are all hard requirements. So the same requirements that get you into a US MD or DO program are the same exact requirements that you have to get into a Caribbean medical school, especially the top schools. I will say, please do your research. If you plan on going to a Caribbean medical school and that is the route that you are taking, I'm not advising against it. I'm just suggesting try not to do that, because, you know, you want to better your chances of getting into a a residency or fellowship because it can get competitive. But if you do decide to go to Caribbean Medical School, please do your research. Do not just follow other people's advice. Do your own research, research programs, talk to people that have graduated from those programs. You know, these places will give statistics on their websites that will falsely inflate the amount of people that match into residency programs from their schools. That is not all reflective of everybody that matches into residency. I know plenty of people that I graduated medical school with that still to this day have not matched into residency, okay, and that went to a Caribbean medical school. So the numbers that they give on their website, 99% of, you know, people that come here match into residency, that comes from a very small pool that they're talking about. Not every person that graduates from a Caribbean medical school matches into residency. Not every person that graduates from a US medical school matches into residency, but the differences are vast. So please do your research and talk to, you know, people that graduated from the program, you know, talk to other, you know, physicians, you know, do your research in terms of, you know, schooling, see what the statistics are, and then go from there.
Great, thank you. There's some people in the chat, I mean, saying, and it's true, thank you for being so transparent and honest about your personal ideas. And kind of going off, I guess this will be your personal opinion, but do you think that it would be better, so like if someone didn't get into an MD-DO school in the US, do you recommend, and then they did in the Caribbean, to go to the Caribbean Medical School, or try to take a year off, do something, make their resume stronger, and then reapply? What are your thoughts on that?
So, you know, if I could go back and do it again, I would have taken a year off. I mean, look at how much time I took off when I was doing training, clearly, and I'm still doing more training now, right? So obviously age doesn't matter to me now. So my thing is that try to get to the best spot that you can get to. Again, this advice does not apply to every single person. Remember, at the end of the day, you have to understand every person is different. Every person has a different timeline. Every person has different circumstances. I didn't have, you know, a husband and kids to deal with at that time. So my circumstances are going to be very different than somebody that has like a family that they need to support, or whatever the case might be, right? Because just understand, once you get into medical school and you go through training, you're not making any money in medical school, and then you go through training, you're making a very minimal salary for years. So that is a real problem for a lot of people that have families to support. That being said, you know, if you are getting to the point where you were not able to get into a med school right away, and you know, you had the option of going and doing a 1-year gap to do a MPH or whatever master's program, or going to a Caribbean school, you know, kind of weigh out your odds and see how good your GPA and your MCAT score are, and see, you know, if you feel like doing the MPH is going to help you. I feel like that's probably going to be the better route, because going to Caribbean medical school can be a little bit risky, in my opinion. Again, is it doable? Yes. But, you know, just know that once you get in, it is a very, very, very difficult path, and people do not, the reason why I'm being transparent about it is because I've been there and I've done that, and I've seen how incredibly not transparent these schools are with you. And I had to go through the process and learn the hard way. And I've seen a lot of my own friends throughout the process have to drop out at different points because it was a really difficult process. Things have become more streamlined now. Like I said, it's been years since I graduated. Things are a lot more streamlined now. So maybe it's not as arduous as it was when I did it. And for the people that came before me, it was even more arduous. So things are becoming a little bit better. But, you know, think of what you want at the end of the day. If you want to do a competitive specialty like orthopedic surgery, don't go to a Caribbean medical school. If you want to do something like neurosurgery, don't go to a Caribbean medical school. Again, is it possible? Yes, but like, you're going to have to work your butt off like that much harder. So I would go the MPH, MBA, master's route if you're not able to get in right away. That would be my, you know, that would be my advice.
Great. Thank you so much for that. I know we all appreciate hearing an advice from someone who's gone through it and who can really tell us the ins and outs. So going back to your undergrad career, what things did you do, or that you recommend that we do now in preparing to stand out? Because it's getting so much more competitive. It feels like everyone has the same exact resume. So what do you think would really help us stand out the most on applications?
You know, it's hard. It's hard to stand out because the like 99%, I wouldn't say 99%, but like more than 90% of the applicants to medical schools are pretty much all the same. Okay. So what my advice, and this is for applying to medical school, this is applying to, residency, this is applying to fellowship. You have to be honest and you have to be yourself. Try to be a well-rounded person, right? Does that mean that you can slack on your grades and your MCATs? No, because at the end of the day, no matter how well-rounded you are, that stuff matters. Do as well as you can do in your GPA, especially when it comes to your pre-med courses. Knock it out of the park. If you need help with a tutor, whatever the heck you need to do, get it done. MCAT wise, I took a MCAT prep course like Kaplan. I don't know if that still exists now, but I took something like that, and that helped me tremendously. So I would really knock, your MCAT out of the park. If you have to take it more than once, that's okay. People take their MCAT twice and it's not the end of the world. Just try to get the best score. And then other things that I would really recommend, try to do some shadowing. I mean, I know we're in a pandemic right now, and hopefully you guys are early on in your college careers. So try to do some shadowing with a couple of physicians, and try to get involved in like 1 or 2 research projects, at least 1 research project, either in the area of your interest or choice, or, just any kind of research project. Especially if you go to university, there's always like, big research programs that are going on, or especially if there's a project you can jump in on, because usually that type of stuff helps. Publishing helps, but even just getting involved in a research program helps. You can volunteer at a hospital, you can shadow a couple of physicians and get some experience that way. And if you're into other stuff, like I volunteered for a nonprofit organization, an international nonprofit organization ever since I was in high school. It's still something that I'm really passionate about, that I'm still a part of now. And every time that I got interviewed, every step of the way, that was one thing that stood out for me, was that, people always asked about that. So don't just put stupid stuff on your resume, just like fluff. Make sure that if it's going to be stuff on your resume, you're going to get asked about it, and you can get asked about it. So make sure you know your stuff inside out. And, I would recommend research. I would recommend volunteering. I would recommend doing stuff you're interested in, extracurriculars. Like I, was part of a couple South Asian clubs that I did, leadership positions in. Like I said, I was a part of a nonprofit. And that stuff helped me, because that was stuff I was genuinely interested in. And then obviously doing well in your GPA and MCAT.
Great. Thank you so much.
Yeah.
So Gloria asked a really good question in the chat. I don't know if you know this, but USMLE Step 1 has been changed to pass-fail.
Right.
And so what do you think that will make it even harder for IMG grads, or even just in general? Do you think it will make it, does it, like, what do you
I think the competitiveness has just gotten that much harder, right? Because now if you're making the USMLE, which is like, that was like the one score trying to get into residency, and even in fellowship that people looked at, especially your step 1. Step 2 wasn't weighted as heavily as your step 1. But now that it's a pass fail, what are they going to be weighing? You know what I mean? So, I mean, for US med students, they might be looking more at the, research that you're producing, or, how well you did in your cores and your, your other elective rotations, and, how well you were viewed by your, mentors and things like that, and the letters of recommendation that you got. But then just think about, if that's how it's going to be in the US, think about how difficult it's going to be for IMGs, right? And so Caribbean med schools, med students are kind of considered foreign grads. So they're in between IMGs from like international medical schools, and then US med schools. So just think about how much more competitive. I feel like it's going to be that much more competitive, because then what are you basing it on, right? I mean, at the end of the day, your school is going to weigh that much more heavily. So it's just becoming more competitive. I mean, unfortunately, I think it's a good thing that, scores are not the be all end all, but then for people that don't even go to a US medical school, I feel like it's going to be, I feel like it's going to be that much more difficult. That's my honest opinion. I know some people can't help it, and some people just have those situations, where they have to go to a different medical school, or they're from in a different country and they're wanting to come here. So I know that switch just happened very recently, and so that hasn't even been weighted into application cycles. I don't know if it's starting with this application cycle, or if it's going to be starting for next year. So it's going to be it's going to be something that we're going to see. But in my opinion, I think it's going to make it competitive for, you know, foreign grads and IMGs, unfortunately.
I think we haven't really seen the repercussions of that yet, so
Yeah.
we won't
Yeah,
really
to
know
be
until
determined.
next year.
To
Yeah.
be determined. Yeah.
So I guess there were some questions about research in general. And so if someone now in their undergrad career, even like in a postback, knows that they want to get into cardiology, what kind of research opportunities do you think that they should look for?
Hard. You know, I get questions from like residents and fellows as to like what kind of research projects they should get into. I mean, okay, so like if we're not going to, you know, if we weren't in a pandemic right now, I think it would be a little bit easier. I think when you're early on in your career, so if you're in college or you're doing a master's program, I think trying to jump in on a project that's already ongoing is usually going to be easier. So, you know, if you were volunteering at a hospital or shadowing, you know, a doctor or whatever, and, you know, they had a research project that they were already working on and it was something of your interest, then I would try to jump in on that project. The other thing that is actually not that difficult to get published is case reports. So if you had an interesting case that you saw in the hospital when you were a student or you were volunteering or, you know, whatever the case might be, those things, that's basically just writing up an interesting case and publishing it, getting it, trying to get it published in a journal or trying to get it accepted at a conference, like a medical conference, like American College of Cardiology or American Heart Association that just passed a couple weekends ago. American College of Cardiology, I think their submissions, probably just or actually it might just be ongoing because the meeting is in May instead of March of next year because they're trying to do an in-person meeting. But you know, those case reports are usually easier to get published. There's also like QI projects that you can try to get in on, which are quality improvement projects, like, you know, working in the hospital, how different kind of you know, mechanistic approaches, logistical approaches that can be worked on in order to improve the flow in hospitals, things like that. So, you know, like I said, early on, it's probably easier to jump in on projects. Later on in your career, when you're in residency and fellowship, it's probably better to try to initiate a project on your own. And then again, trying to do like a case report, writing something interesting. The other thing that you can also do is do like a meta-analysis. Those are usually, you know, not difficult because all you're doing is just looking and doing it retrospectively. So you're just basically looking at a bunch of articles and kind of coming up with your own, you know, ideas. This is a very generic, generic message, but kind of just coming up with your own ideas. Retrospective analysis is always easier than doing a prospective because then you don't, you know, you need time to do prospective research. So case reports, trying to do like a meta-analysis, doing retrospective versus prospective, and jumping in on research projects that are already established so you can just try to get your name on something.
Yeah, I think that's really great advice. Thank you so much.
Mm-hmm.
And then, so there were some questions about your locums position, and I mean, to whatever extent you feel comfortable sharing, but how does that impact like your family relationships, any personal relationships, with you traveling so much and being away? What kind of toll does that take on you just as a person?
I mean, that's a really good question. I don't mind being personal about it. I mean, you know, I think one of the names of the game of doing locums, the negative aspect of it is that you are traveling, right? So I've been fortunate enough that I only have had 2 assignments so far. So the first assignment that I had was actually also located in Pennsylvania. It was only 2 hours outside of Philadelphia, so it wasn't that far. And my home base was in Philly. I don't have kids yet, and so that is not an issue for me. The pandemic actually made things worse. So it really wasn't doing locums because I had all the time in the world to see family and friends, but it was the pandemic that didn't allow me to travel. Had it not been for the pandemic, I had about like a 4-month period where I was able to travel. I went back to California several times. You know, I really made the most of my off time. I was able to go internationally, you know, to a couple of countries, but, you know, then the pandemic hit and it was like, it doesn't matter what kind of life I had, everything kind of got thrown out the window, you know? And so I had to make the best of it. So, but yeah, I mean, in general, if it wasn't for the pandemic, I think it's just the traveling that makes it difficult and, you know, kind of this like choppy type of schedule. It's not for everybody. Usually the people that end up doing locums are people that end up, people that are very early on in their careers after they graduate residency or fellowship, and then people that are like about to retire or want to retire and just want to have some like part-time type of work. Unfortunately, locums are not usually going to be centered in a major city. So it's not going to be in like Los Angeles or Miami or Chicago or, New York City. It's usually going to be in like a more rural type of area. And if you're lucky, it's going to be close to, some kind of city, but most of the times it's like not close to a major city. So you're usually like, a few hours away from a major city. Like right now, the place that I'm in upstate New York. So I'm like 4 hours outside of Philly or 4 hours outside of, New York City. So it can be a little, lonely. You're kind of like stuck in a hotel room, but you kind of have to make the best of your situation. This is not a lifestyle that I want to keep up for very long. Obviously, I don't recommend it for everybody. I was actually in the process of finding a permanent job after a year of doing locums because I was getting so sick of it and I didn't like the lifestyle. But then I decided to do this advanced imaging fellowship and things kind of just worked out that way. And so, and my schedule in locums is actually really great now. I'm only working Monday through Friday, 2 weeks a month. And I pretty much make really good money. So, I'm not complaining. And so and I'm making the most of the pandemic, the best that I can do. And, social media, doing this like public profile that I have and doing this heart to heart series that I have on Instagram with one of my other cardiology friends has really kept me busy. I've been a part of, the American Heart and, American College of Cardiology and getting involved in that way too. So I've definitely been able to, keep myself busy. But yeah, can locums become, not the best situation? Yes, I don't recommend it for everybody. So it's on a case by case basis.
Yeah, you said it yourself, and you're making the best of every situation. So we appreciate you sharing that with us.
Yeah.
There were some questions, and I thought they were really interesting. You mentioned being a part of some South Asian groups during undergrad.
Yeah.
And
Yeah.
so there was several people wondering, how did you deal with like coming from that kind of backgrounds with your parents and your family? There's like a huge stigma about like 4 years undergrad, 4 years medical school. How did you kind of work around that and get through that like non-traditional path? And I feel like
Oh
that's a very
God, I'm still
loaded
dealing
question.
with it right now. Okay. And for all my South Asian brothers and sisters, I feel ya. Okay. My mom is on my butt right now for many reasons. And, but at the end of the day, you got to do you. You know what I mean? Like you just got to do you. If you're passionate about something and if you want to have a goal in life, you gotta live your life for yourself. You're not living your life for your family. You're not living your life for, anybody else but yourself. And so I've always wanted to be a doctor. I was like one of the few people whose parents did not push me to be a doctor. My dad wanted me to be a lawyer, funny enough, probably because I talk too much and I love getting into arguments, not at work. And my mom wanted to be a doctor herself, but she ultimately ended up being a PhD and an MBA, and she's extremely accomplished. And I think that that's where my drive came from to, pursue, some kind of professional career. And, and so my dad wasn't happy that I went to med school. My mom was happy that I went to med school, but, both my parents at the end of the day, ultimately my dad kind of was like, all right, wow. And now he, seeing everything that I've been through, he, tells everyone and their mom that, he's so proud of me, and that makes me so happy. And same thing with my mom. And I think they've just seen that, irregardless of whatever they're going to tell me, I'm going to, make my dream a reality. And now that I'm actually a cardiologist, can I just tell you, like, it is the most heartwarming feeling. Like there are days I can even get emotional about this, but there are days I'll wake up and I still can't even believe that I'm doing what I'm doing. But when your parents tell you that they're proud of you for what you do, that is just the most amazing, fulfilling, it's just like, I'm going to get emotional, but it's just like being able to fulfill this dream and doing this, and being able to make your parents proud, even at times when you felt completely isolated, and being able to make your parents proud is the most amazing feeling. Being able to talk to my dad and help him, and understand his conditions and have him put that trust in me, being able to talk to my mom and just for her to just be like, I'm so proud of you. Like, look at everything that you've been through and look at where you are today. None of the other stuff, none of the other stuff matters. Are they still on my case about getting married and having kids and all those things? Of course. But, you know, I remind them I'm an adult. I can take care of myself. I'm a huge believer in, you know, God having a plan for everybody and things happening at their own time. And, you know, I look at some of the people that I've grown up with in the South Asian community that maybe got married 10 years ago and are now divorced and have a difficult time. Maybe they're married and they're unhappy in their marriage and they weren't able to accomplish their goals. This is what came first for me, and I'm extremely grateful for it, and everything else will come when it's supposed to, and I'm a huge believer in that. So always go after your dreams. You know, your family, if they love you, they'll respect you for it and they'll support you.
That was awesome. Thank you so much. You can see
Yeah.
in the chat all the support that you got from that. I think that was such a beautiful note to end on. So I guess the one last question that I have for you is, what lasting advice do you have for us undergrad, postback students now with COVID?
Oh God, just stick with it, guys. I mean, this is hard for everybody. COVID is hard for everybody. I will say that there is a light at the end of the tunnels. This is not going to last forever. Thank God we have science, right? And we have vaccines that are on the way. And so this is going to be something, hopefully, that's going to be short-lived, and we'll be able to get back to some kind of normalcy by this time next year. But I understand the struggle. If I was in your shoes and having to do, you know, virtual learning and, you know, do virtual classes and not being able to have the same interactions with my friends and my colleagues and my teachers during high school and college, I don't know what I would do. So I give props to you guys to be able to have to adapt to this new environment, but just understand that it's short-lived. It's not going to last forever. Make the best of the situation. You know, all of the cards that you're dealt with, and understand that when you're applying to med school and, you know, all of these, you know, things that if you have this, you know, on your resume, or, you know, people understand that you were in a pandemic when all of these things are happening, I think that people are going to be a little bit more understanding and have a little bit more compassion for the fact that you are going through this mess. You know, just like everybody else, the whole world has had to adjust to a completely different lifestyle. So, you know, like I said, it's going to be short-lived. Stick with it. You know, whatever you want to do, you're going to be able to do. Look at my story. I mean, honestly, I'm still figuring life out, but, you know, I've been able to make some of my dreams a reality, and you'll be able to do the same. So just stick with it. It'll be okay.
Thank you so much. We absolutely love your transparency and your honesty. This was amazing. I know that everyone appreciated it so much.
Yeah.
Someone earlier said that you were changing their whole perspective, but in a good way. So thank you so much for your time. This was absolutely amazing. You can open the chat and just see the thanks pouring in.
I'm seeing it all. Get a little emotional. Thanks, guys. It means so much to me. Thank you. And if you want to follow me, follow my journey, you can follow me on Instagram at Dr. Ambreen Mohamed on Instagram. I don't know if you want to put that in the chat just so we have it, or, you know, wherever. And reach out to me, DM me. I'm, you know, sometimes I'm a little slow to respond just because I'm working or whatever, you know, the case might be, but I'm happy to help you in any way that I can. I don't know how much I can do, but, you know, I'm really happy to help in any way that I can. So even if it's just a little advice, a little pick me up, whatever you need, let me know. And then I'll try to do my best to help you.
Thank you so much. We hope you have a great rest of your night, I guess, and a Thanksgiving.
Thank you.
Yes.
Thanks. And you guys too, stay safe, mask up, socially distance. Don't do these big holiday get-togethers, okay? We want to be able to have a great holiday next year. So be safe. All right. Thanks, guys.
Thank you. Good night. Bye.
Bye. Bye.